Hello there, this is John speaking, and this is the King Airway insertion skill. First, I want to make sure the scene is safe, obviously, and I have my safety glasses and my gloves on. The next thing I'm going to have my partner do is I'm going to have my partner insert an oral pharyngeal airway and have them ventilate the patient with 100% oxygen once every 6 seconds to hyperoxygenate the patient in preparation for the intubation. So they're going to roll the mask onto the nose and onto the face, and they're going to ventilate. So they're ventilating right now 1 every 6 seconds for me. In the meantime, I'm going to check out my equipment, make sure I have everything I need to complete the intubation. So I have my King Airways. This patient happens to be 4'6". I'm going to use a size 3 King Airway. I have a syringe, I have a colorimetric device, stethoscope, lubricant, tube tamer, and cervical collar. First thing I want to do is I want to check out my equipment, make sure everything's working correctly. So I'm going to take the syringe, I'm going to pull it back to 50 mLs or 50 mLs, and I'm going to inflate the balloons of the King Airway to make sure it's holding air. So push all the air in, remove the syringe to make sure the cuffs as well as the valve are holding air. They all seem to be holding air pretty well. I'm going to pull all that air out in preparation for the intubation. Reset my syringe back to the 50 milliliters. I'm going to lubricate the back side of the device. So on the back side of that, put some KY on there. I've got everything ready to go. I'm also going to, when I ask my partner to take out the OPA and stop ventilating, I'm going to have them put the colorimetric device, take off the mask from the BVM and replace it with this. So my partner will do that for me. Looks like this. Next thing I want to do is they'll take off the BVM and the mask. They'll pull out the OPA for me. I want to make sure everything's kind of in close proximity. I'm going to come over here at the head of the patient, place the head in a neutral sniffing position, grasp the tongue and jaw to displace the jaw forward and the tongue out of the way. I'm going to insert this at a 90-degree angle perpendicular to the midline of the person's body. And then once it gets to the base of the tongue, I'm going to rotate it and slide it all the way down the midline until the flange, the colored flange, touches the teeth. Next thing I want to do is I want to inflate the balloons and create a seal inside the oral pharynx. So the balloons have been inflated. Then I'm going to take the BVM away from my partner. I'm going to place it onto the King Airway, and as I'm squeezing the bag, I'm going to withdraw the device until I get optimal ventilation with minimal resistance. You'll feel a marked difference at a certain point. So right about there, it feels really good. I'm going to check and see. So I have 12 centimeters at the teeth, so I measured the depth of insertion. I'm going to have my partner now take over ventilations for me 1 every 6 seconds. So they're doing that for me. At this point now, I'm going to listen to epigastric sounds. Give me 1 breath. I hear no epigastric sounds. 1 more breath. Right side lung sounds, left side lung sounds. Good rise and fall of the chest. My third and final verification is I'm checking for my colorimetric device. It's yellow and 5.0. I can now secure it using the tube tamer. My partner is still ventilating. I'm going to place this in from the right side of the patient. Make sure that the opening goes towards the feet. Make sure the bite stick goes into the mouth. I'm going to secure the tube using this wedge clamping device, the white knob. And then I'm going to secure the device around the back of the patient's neck and Velcro it in place. Next thing I'm going to do, the last thing I want to do is I want to put on a cervical collar. Place it from the right side. Nice and snug, nice and straight. So at this point, my partner is ventilating. I've completely secured the device. I'm going to call the hospital. I'm going to give them the SD lead. So my size was a size 3. My depth was 12 centimeters. My lung sounds were clear bilaterally with good rise and fall of the chest. The end tidal was yellow and 5.0. The abdominal sounds were negative. And of course, the last G is going to be I'm going to document all of this at least twice on my patient care report. And I need to also report this on the radio to the radio nurse en route to the hospital. And we're done.